Dr. Vikki Petersen here. Last week, the USA Today published an article that basically intimated that we were all getting adequate levels of vitamin D. Several patients then came into the clinic and were concerned because we have them on higher doses than the 400 international units that was recommended in this article. Of course, that was attributed to their lab test, which showed them extremely deficient in vitamin D. But certainly, you read an article in a national newspaper and you can have questions, because this article definitely made it sound as if the basic 400 international units that most people take in a multiple vitamin was more than enough, and that they had assessed and we were okay when it came to our vitamin D level. Well, I disagree. And so do most researchers in the field. Now, the article did, a paragraph or two later, state that their findings were being argued against by vitamin D experts, but it was the title, and a lot of times that's as far as we Americans get in certain areas. I mean, if it's not, if you're not a clinician or you're not highly interested in this, you see the title and you go, wow, then what's the big fuss? Why am I taking extra vitamin D? A doctor by the name of Dr. Michael Holick in 2007 and 2008 did the seminal work, really, in the area of vitamin D, and he has amazing research in this area, and I'm just going to give you a little bit of little tidbit of some of it. But his analysis after his research was that 1 billion of us on this planet, that's billion with a B, are deficient. So I ask you, did that suddenly all repair itself in the matter of a couple of years? No, it did not. It's also, while I think vitamin D deficiency is really critical for everyone, and we should all have our numbers, you should go and you should get a lab test. It's called 25-hydroxy vitamin D. It's a basic vitamin D blood test, and we should all get that done. We should find out what our number is, but it's especially important for those who are malabsorbing their fats at all. And as you know, I talk a lot about gluten sensitivity and celiac disease, and those people who have damage to their small intestine, one of the things they do malabsorb is the fat-soluble vitamins, and vitamin D is one of those. So those people are at particular risk, but it seems that the general risk profile is quite high amongst most of us on this planet, based on Dr. Holick's work. So what does vitamin D do? What does it set you up for disease-wise? It increases your rate of cancer. It increases your rate of heart disease. It increases your risk for autoimmune disease. So realize I've just listed off the 3 leading causes of death in this country. So heart disease, cancer, autoimmune disease, those are the top 3 right there. In addition to that, it raises your risk for infection. And what else does it do? Oh, the one thing we do know and is well accepted is that with D deficiency, you're more likely to get bone loss, osteoporosis. Also, muscle strength decreases with vitamin D deficiency. So it's a very wide array of issues that it affects. Now, how do we get vitamin D? Oily fish, although they've done studies on people eating salmon once or twice a week and they were still deficient. So you'd maybe have to eat a lot of oily fish to get your vitamin D level where it needs to be. Certainly supplementation is another thing. I prefer the micellized or the fat-soluble form of vitamin D, so it's actually in a liquid. It's in olive oil, so you just take a couple of drops and it tastes like a few drops of olive oil, so it's very palatable. That's what we recommend. There's been some studies. They did a study on, this is relating to autoimmune disease. So this was done on infants in Finland. And Finland's obviously a very northern latitude, so they're not getting a tremendous amount of sun. And what they did was they took 10,000 infants, and for their first year of life, they gave them 2,000 international units of vitamin D. So of course that's quite a bit higher than the 400 that this article is saying. And then they followed these children for many years, and they found that their risk for, or their rate of, I should say, type 1 diabetes decreased 80% over the general population. So that's huge, huge impact. They found women with the highest vitamin D levels had a 50% lower risk for breast cancer. So if you want to look up Dr. Holick, it's Holick, tons of research on this, and this isn't the forum to go over step after step after step, although I am going to be writing a blog about this as well. But I really want you to know that it's very important that you get your vitamin D level checked, that you don't listen to this article that says we're all fine. 400 international units is not considered even a good maintenance level. It's more 800 is what the researchers are saying, 800 international units, but that's to maintain. That's not to get you where you need to be. And from teens to youngsters to elderly, we see across the board levels below 20, which is very, very low. So you really want your levels around 50 to 80. The higher end, especially if there's a increased risk of cancer or you've had cancer, and then somewhere between maybe 50, 65, 70 is a good just general level for most people to help prevent. So realize we're far afield from just preventing rickets, which was a bone disease, and originally it was just, oh, get to the level where you don't get rickets and you have enough vitamin D. That's far afield from what we're talking about here in the prevention of all these diseases. So what can you do? Number one, get a blood test. Number two, supplement. For those of you who suffer fat malabsorption, I know celiacs who have trouble even with a good form of vitamin D supplementation, getting that level up. And this is a recommendation I thought I would never say, but here you go. You can go to a tanning bed. You do about 50% of the time they recommend. Make sure you sunscreen your face. And if you go the lower time, 50% of the recommended time, you will not be at risk to sunburn and any of the negative effects, but you will raise your vitamin D. So that can be very helpful for the people who are having trouble absorbing. All right, so please pass this along. This is a very important area. It's so silly for us to be at risk for these diseases that supplementing and getting a nice, healthy, robust level of vitamin D would really help prevent. So until next time, I wish you very good health.